So first, I just want to thank you for your time, for allowing me to interview you. Like I said, you feel free to say as little or as much as you like about anything in particular. And if at any point you become uncomfortable or offended about anything, you have the right to end the interview whenever you want. Okay, so this is Summer Cunningham interviewing Melissa Dick, IUP Director of Health Services, on Friday, February 24th, 2023, in the IUP Health Services office. This interview serves as a piece in a larger effort to record and document the experience of IUP students, employees, and community members during the COVID-19 pandemic. Okay, so I'm going to get right into the questions. Okay. What originally interested you in joining the medical field?
Oh gosh, well, I've been a nurse for 29 years. I would have to say in high school I worked at a personal care home, just like taking care of people. Always sort of had that caring need to care for others. And nursing was the only choice for me at that point in time, so yeah. I started out working geriatrics, but then made an abrupt change to emergency nursing, working in the emergency room, and worked in the emergency. I still work in the emergency room casual, but I've been there 25 years. Came to College Health in 2013. I like the hours and the work-life balance working here versus the emergency room, but I still have a passion for emergency nursing, so I still keep my foot in the door.
Okay. Where did you receive your education in nursing?
I went to school at Duquesne University in Pittsburgh. I only live about 20 minutes outside of Indiana, and I knew I wanted to be somewhere in a city so that I could experience the bigger hospitals, but universities like Pitt kind of intimidated me because I have a cornfield and cows in my backyard, and being that close to city, the ins and outs of city life kind of intimidated me, and Duquesne kind of sat up on the hill by itself, and so I was in the city but I wasn't in the city. So I went to Duquesne for 4 years, had a great experience there, and came back to work at Indiana.
Okay. How did you find your way to becoming the director of IUP's Health Services?
Incidentally, while I was in the emergency room, I had worked with some staff members who went on to get, from their RN, to get their nurse practitioner certification and were working here. And their previous director was leaving, and they mentioned to me that, you know, this job opportunity might open, and it's a great life-work balance, and I had taken care of college students in the emergency room, so it would just be a little bit different pace for me, and I thought, you know what, I'm ready for a little bit of a change. My body wasn't adjusting to night shifts and 12-hour shifts as well as they used to when I first got into nursing, so I thought, why not? And I've always liked to teach and educate, and I was a charge nurse in the emergency room, so it just seemed like a good fit for me. And that's how I ended up here in 2013.
What types of adversity, if any, do you think you faced on the road to where you are today?
Gosh, that's a hard, not so much a hard question. I just guess I really don't know how to answer it. I usually put my mind to something, and then I just kind of do it. I wouldn't really say I've had a lot of adversity or problems, you know, pursuing things that I want to do. I've always told my kids, you know, if you want to do something, it's up to you to get to that point, you know. So just to keep trying.
Did you see yourself in a position such as this at the beginning of your education in this field?
No. When I went into nursing, my dream job was to be a labor and delivery nurse and deliver help deliver little babies. So to be working with College Health, I never imagined that I would be here, but this is a great place for nurses. You know, seeing so many different students from so many different backgrounds. They teach me things on a daily basis, just from their backgrounds, their experiences. Public health, we're always going to have public health, and that's a lot of what we do. teaching students to navigate healthcare. The decisions they make now are definitely going to affect them and impact them later on in life. So nutrition, things that how they take care of themselves as far as nutrition, socially, medications that they take, exercise, like everything that they do right now in their life is going to impact them down the road. So if we can impact them and have a positive impact, that's just awesome.
How different would you say your job here is versus working in the ER?
Well, the volume, first of all. The volume of the ER it's just nonstop. It's just one patient after another, and you have no idea what is going to be walking through that door. So you're constantly on. You constantly have to just be ready and prepared to take care of whatever comes through the door. Where here it's a little bit more controlled. We still have emergencies that come through the door or that we have to respond to here in the office, but not nearly to the extreme that the emergency room would. So I would have to say that it's similar, very much so, and you're still using your assessment skills to recognize certain things when students come in, but the volume and the sheer emergent need is not there compared to the emergency room.
What were your initial thoughts when you first realized the seriousness of COVID-19?
Well, I will remember this always. I had been notified that there was a student who traveled back from China and was being quarantined. And a lot of folks were very panic-stricken, like, oh my goodness, what are we going to do? And I'm the type of person, from working in the emergency room, I don't get too fussed up about much. And I was just like, it's fine. We will just do what we have to do. We follow the guidelines according to the CDC, what their recommendations are, and we'll just go about our, about our business and do what we have to. And honestly, throughout the pandemic, I never really got too fussed up about it. It affects everybody differently, and everybody experiences these types of things differently. But I think from my emergency background, I am just sort of trained not to become panicked about different situations. I never expected the pandemic to get to the point that it did when I initially heard about it. Because we have infectious processes all the time. There's the Middle Eastern respiratory virus, MERS, Ebola. We had, been prepared for Ebola and different things. So you just prepare, and, when it happens, it happens. If it doesn't happen, great. But we're used to taking care of those types of situations. And I never imagined that we would get to a point where everything was on lockdown, that hospitals would run out of ventilators, that we would see the just volumes of sick people as we did. I never anticipated it getting to that point. So I guess to answer your question, the seriousness when we got to that point where hospitals were running out of ventilators, where people were waiting in the hallways for care, and especially when you would hear stories on the news about families who weren't unable to be with their loved ones when they passed away from the virus. They weren't allowed in the hospital, and that to me just ripped me apart because, it would have been horrible to have to experience that. I personally, fortunately, didn't have to experience that, but so many people did, and that's the sad part of this virus, how it affected so many other people in society.
Where did you see the future of your career during these times?
I think that I saw more opportunities in public health. The Department of Health and the CDC was crucial in helping us to navigate what we did, when we did it, and how we did it. So I will definitely be looking and for updated and new, different, whatever things come out that we need to make our students aware of. New infectious diseases and processes and how to keep them safe. The progression and development of vaccines. I've watched it develop and into this new vaccine to protect us from all of these problems, and just that development and how all of that progressed was very interesting and eye-opening to me. So I learned. You always think, oh, I've learned all I can learn. Not in healthcare, not in this profession. You just keep learning every day. So I'm open to learning more as it's presented to me.
How did your role change as the director when it got a bit more serious?
Sure. So our day-to-day operation here, we would see students for various different health conditions, and we would have anywhere between 80 to 100 kids walk through our doors, and that was normal and manageable for us. When the pandemic was at its peak, our phone calls, and I think I mentioned this at one point, from August 2020 to December 2020, our phone records, we had over 51,000 phone calls coming in and out of our office. We were sort of like the hub for IUP community, other different labs calling in results. We had parents, grandparents, sisters, brothers, students, faculty, staff, all calling us, wanting advice, wanting recommendations, wanting to know, okay, what do they do now? So we kind of became the hub of information and helping people determine, okay, this is what you need to do. This is, you have to wait this long to do this. This is when you can go back to class. So for me, trying to manage all of that and keep it organized and systematic so that everybody was getting their answers and being taken care of and knew exactly what they needed to do and when they needed to do it. That was a challenge for me. But it was a good challenge, and I enjoyed being part of all of that, and helping the university sort of put the information out there to make sure that they had what the current, most up-to-date recommendations and guidelines were pertaining to COVID, and help them manage how to best keep everyone safe. That was different than my role prior to the pandemic. So it was a good experience, and I really learned a lot from it.
How difficult was it for you to adjust to frequent updates and changes throughout the course of the pandemic?
Yeah, honestly, I felt like I was on a roller coaster every day. I didn't know if I was going to be up or down because it was constantly changing. The isolation timing, the quarantine timing. Now you don't have to quarantine. You quarantine if you have a vaccination, and if you do have a vaccination, you don't have to quarantine. So that was a constant roller coaster ride, trying to keep up to date with that stuff, because it changed within 24 hours. I would come back in, and the next day, or I would be watching the news at night, and something else would change, and I'd have to go make sure that we were doing what we were supposed to be doing based on those changes and guidelines. So it was definitely a roller coaster ride. It is just now sort of leveling out, and we're just all sort of taking a deep breath. So it was interesting. I wouldn't say it was a fun ride, but it was a ride.
What physical and mental tolls did working through the pandemic have on you?
Honestly, again, working in the emergency room, you're just used to having things thrown at you, one after another, and changes, and you just have to kind of adapt and be flexible. I'm glad our phones are not ringing off the hook nonstop. That's definitely quieted down. The urgency and the panic of our community has sort of leveled off. And I think just seeing how panicked and overwhelmed the community was by all of this gave me a little bit of anxiety. But I'm glad that it's now, not as an urgent issue, and people are getting a little bit more used to it. So I don't know if that answered your question, but
How did you balance the increased risk to yourself with the urgent need for your patients?
Sure, that's a great question. We're taught to always take precautions. So we already had N95 masks. We were already trained in isolating and preventing disease by frequent hand washing. That's stuff that we always do. Now we just had to put it into practice. So I think that the fear and the anxiety that the public had wasn't as great for people in healthcare because it's stuff that we've always had to do. It was just at a larger magnitude. We had to do it much more frequently, and so I think that there's a different experience for everybody. For myself, it wasn't as big of an issue because, like I said, we have drills every year on just this with TB and MERS and those other types of airborne respiratory illnesses. We had policies and protocols and practices in place that we practiced routinely to make sure that we were prepared for any kind of airborne illness. It was just the magnitude, the just overwhelming magnitude of how many people were affected by it that was overwhelming and a little scary.
What did you think of the treatment of frontline and essential workers during the pandemic?
Well, I'm certainly grateful that they acknowledged the time and the effort and the energy and the compassion that healthcare workers put forth to all of these folks. But it was a little unfortunate because you still hear stories of nurses and hospitals being short-staffed, lack of supplies, lack of recognition of their efforts, working 14, 16, 24 hours at a time just to take care of patients. So, a lot of people left nursing because of the overworked, overstrained, overstressed, lack of support there towards the end of the pandemic here. And it forced everybody else who stayed to work harder and to kind of suffer because of it. But initially it was wonderful for the public to recognize the amount of work and dedication that healthcare workers put forth, not just nurses, but emergency management personnel, EMS, everybody kind of had to step up and really do their part to keep everyone safe. And I think for the most part, and people may argue with me here, but for the most part, I think everyone did a pretty good job, based on what we had to work with and where it ended up. So,
what lessons, if any, have the pandemic taught you?
Lessons. Well, I sort of have a little bit of a motto to always be proactive instead of reactive. So my lesson is to continue to be proactive, to always be one step ahead and always be prepared. And in emergency nursing, you have to be that. You have to always be prepared and ready to do whatever it is that needs to be done. So just continuing to be proactive instead of reactive, and not only in the pandemic, but anything. It's always a good kind of thing to keep in the back of your mind. Don't react when it's already happened, but be proactive to prevent problems down the road when it does happen. So be prepared, flexible, and adaptable, and continuing to be that way. Nobody benefits when you lose control, and it's just not a good situation. Yeah.
How does your increased workload in the midst of the pandemic affect your relationships outside of work?
Well, my husband and I have been married for a long time. He knows what goes into nursing. He knows that, we always tend to care a little bit extra. So I can't really say that it was affected, negatively one way or the other. You have a job to do and you do it, and that's just what you do. The pandemic, as far as relationships, just because you weren't allowed to see people and you weren't allowed to go outside and be in public, that was different. I'm a bit of a homebody, so I'm not a social kind of person, and I don't go out very much except maybe to get my groceries, but it was strange to be on campus because we've been here since the beginning of the pandemic, and we've really never left, where a lot of folks went remote, and so not seeing people on campus was very different and strange. Not seeing students, it was terrible because I love looking out my window and watching them walking up and down, and not seeing people was an adjustment. But other than that, I can't really say that it was one negative one way or the other, or it didn't really impact me a ton.
What was your life at home like during the pandemic?
Well, because you're a nurse, you always get your neighbors, your relatives, everybody calling you, I have a sore throat, what should I do? I think I have a fever, what should I do? Where can I go get tested? Do I need a vaccine? So got a lot more calls and requests for family members, my opinion on different things. But other than that, didn't change too much. It was just the neighbors and the family members that knocking on your door, or stopping outside their car window, winding their window down, asking me to look at their throat or something like that. So other than that, not too much. Not seeing people over the holidays. That's always a bummer. But we're back now, so it's all good.
What is your life at home like now?
Basically the same. I'm not gonna lie. I'll still get people to call in and asking questions and recommendations and things, because the guidance out there is still a little fuzzy. Especially when the boosters came out, the bivalent boosters. Should I get one? Should I? What have you heard? Those types of things. Which one should I get? You always have people asking those just because they know that we get more information than just the news. The news can scare anybody sometimes because they have a tendency to produce a lot of drama with their updates and whatnot. But my daughter loves to travel, so she was a little miffed because she couldn't do a lot of traveling during the pandemic, so she's enjoying traveling now. But other than that, I can't really say that it's changed a whole lot. Still do what we do and go about our business. I have gotten rid of all my masks in my car. I had quite a collection build up from having to wear a mask everywhere. I still have a lot of hand sanitizer. So if you get anything out of this, hand sanitize when you leave your car, and when you get back into your car, before you touch that steering wheel, put hand sanitizer on your hands. Grocery store, getting gas, going to the ATM, whatever it is, just use that hand sanitizer.
What were your initial thoughts when the vaccine initially became available?
So I'm not a huge vaccine promoter, and I'm not a huge non-vaccine kind of person, if that makes sense. So I am sort of neutral. I think that, yes, they definitely can help some people, but I think it has to be your own decision, and it's your body. I did not agree with the fact that, the government was saying that healthcare professionals have to get the vaccine. I think it has to be an individual decision, and nobody can make that decision for you except yourself. You have to get all the information and make a decision as to whether this is going to be good for me or this isn't going to be good for me. So a lot of people in healthcare, a lot of people not in healthcare will argue tooth and nail. It is good, it isn't good, you should get it, you shouldn't get it. And I'm just really neutral. It really depends on your medical history, your past experiences with vaccines. So yeah, I am going to stay neutral on that question. I think that it did help a lot of people feel safer to be out and about, knowing that they were vaccinated, and that's great. That works for them. But there's still lots of people who have not been vaccinated, and they're out and about. So yeah, I'm not going to take a side on that question.
How do you think the spread of misinformation affected the efficiency of medical care during the pandemic?
And see, that is where I do sort of have a bit of a strong opinion. I would watch the news at night, and depending on what station you watched, depending on what social media platform you were scrolling through, it sort of upset me to know that there was so much misinformation out there, and people were relying on that information. You know, they took it as that was gospel truth. That was what you were supposed to do, and so much of that, you know, just distorted people's feelings about information and how they need to take care of themselves and what they need to do. We based everything that we did and how we reacted on the CDC and the PA Department of Health. And even their information sometimes was a little bit not equalized, but on the same wavelength. So, you know, the CDC would come out with something, but the PA Department of Health sort of lagged behind a little bit until they actually updated their information. So, factual sources is where I based my recommendations to the university on, and collaborating with our supervising physician here as to what we disseminated. But I know folks at home, you know, in the public that don't have a healthcare background or access to this type of thing, you know, they would watch TV and there was a lot of misinformation out there, and that was kind of sad. So yeah, I can understand why people wouldn't trust the government. They wouldn't trust the vaccine, or they wouldn't trust treatments for COVID, because there was just a lot of unknowns out there, and it's unfortunate, but
what's the closest experience you've had in your medical career to the COVID-19 pandemic?
Gosh, I don't think anything that I've done in my career has ever measured up to the magnitude of COVID, but I've taken care of people with tuberculosis. I did not have to take care of anybody with Ebola, but I think that Ebola prepared us for what we do and how we do it. You know, just making sure that we had supplies available, how to recognize that if somebody traveled, to screen them for certain things, those types of things. But in medicine, you're always sort of on guard and making sure that, you know, you eliminate or try not to transmit disease and infection. That's, you know, you're always trying to do that. So that is part of COVID. It's just this was on such a larger scale that I've never had to deal with anything like that. The flu, I guess I would say we've had some pretty bad flu seasons in the past. And so just trying to, you know, educate people on, if you're sick, stay home, you know, treat your symptoms and try not to transmit that to somebody else so that it doesn't become this magnitude. And COVID was just so new. Nobody knew anything about it, and I think that was the scary part.
What requirements or practices picked up during the pandemic do you still find yourself doing today?
Hand sanitizer. We've always had hand sanitizer all through our waiting room. We've always had masks all through our waiting room. Just nobody used them. So personally, I will be honest, I didn't have hand sanitizer in my car pre-COVID. I had it in my purse, but it usually expired or got bad before I would have to throw it away and get a new one. And now, honestly, knock on some wood, I've not had COVID throughout this entire pandemic. And I'm not saying it's because I use hand sanitizer. I think I'm very aware of where my hands go, and so and honestly, they're extremely rough because I'm constantly washing them, constantly hand sanitizing them, and I'm aware of what I'm touching so that I don't expose myself. So I guess I really didn't do that as much pre-pandemic, but I definitely did it during the pandemic, and I'm continuing to do it to make sure that I stay healthy.
What types of technologies or resources did you use during the pandemic that you had little to no experience with?
That is a neat question. I like that question. That is one thing. I can give a shot like nobody's business, but computers and we just don't see eye to eye. So Zoom was something that I had no idea about, but now it's just part of what you do. You Zoom on and have a meeting. You Zoom and discuss something. So that technology allowed us to take care of students at home when everybody went remote. We were able to have a telehealth visit with a student in their bedroom. They would tell us their symptoms. We would be able to tell them where they can go in the community to get testing, what to do, how long to isolate, and they weren't infecting other people by coming into our office. So that was a great thing to have, and it was a different way of doing what we do, but certainly was an advantage to us and the students. And I will say too, pre-pandemic, I wouldn't be able to make a lot of meetings outside of IUP or even at IUP because it's hard to leave when we have appointments, and now I can still stay in the office to make sure that nobody needs anything and attend a meeting because it's on Zoom. So that has brought about a lot of advantages. And I know FaceTime, people use FaceTime way more now probably than they did pre-pandemic just to stay in touch with their family and friends. So that was a great technology that we definitely used way more than we had pre-pandemic.
Going on 3 years since the start of the pandemic, what do you think is the biggest change this community has faced as a result?
Well, the IUP community, I think that we're more prepared to handle something in the future. You know, if something like this should happen to present itself in the future, we're much more prepared to switch online now for the students, because I know that was a big adjustment, you know, moving classes online, having the telehealth capabilities, the telecounseling abilities. So I would have to say that we're just in a better position to successfully manage something in the future that would happen, that we would have to change quickly and adapt quickly. I wouldn't say that we were super prepared. We managed, and I think we did a great at it personally compared to other universities, other university health services. I think we did an awesome job that way. But as an IUP community, I think that we're just better prepared to handle something like this in the future.
All right, well, I think that's a good place to stop.
Alrighty, well, thanks so much.
Go ahead, stop recording.
Well, that was fairly painless.